Today, we're tackling a topic that affects tens of millions of men worldwide, the PSA test. Whether you're in your 40s, 50s, or beyond, understanding your PSA, the prostate-specific antigen, is crucial for safeguarding your health and staying ahead of potential prostate cancer risks. But what exactly is PSA? Why has it become such a controversial subject in the medical community? And most importantly, what should your PSA level be if you don't have prostate cancer? Let's begin by tracing the origins of the PSA test. The PSA blood test has become a familiar phrase for many men during annual checkups. In fact, one patient once described PSA as the check engine light blood test for men. And that's a fitting analogy. Just as your car's check engine light doesn't tell you exactly what's wrong, the PSA test doesn't measure one specific thing or offer a definitive diagnosis. Instead, it signals that something may need attention, a prompt to see your healthcare provider, get checked out, and understand what's happening with your prostate. But if it's essentially a warning signal, why is PSA testing so controversial? The answer lies in how we respond to that check engine light. Imagine going to a mechanic who, at the sight of the light, immediately recommends expensive, unnecessary work on your car. In the world of prostate cancer, it's not about dishonesty, but rather about the rapid pace of advances in medical technology. For decades, hearing the word cancer triggered an understandable sense of urgency. Act quickly, pursue surgery, save your life. This was a logical conclusion 15 or 20 years ago when our understanding was more limited. However, we now know that prostate cancer isn't a single disease. There are many types, and many cases are mild and don't require immediate treatment. The challenge has been that as technology and knowledge have advanced, the medical community has sometimes struggled to keep up. The industry is slowly shifting to recognize that not all prostate cancers demand aggressive intervention right away. This is the heart of the controversy. There's nothing inherently wrong with the PSA test itself. Problems arise when it's misunderstood or misapplied. The PSA test should be interpreted as a check engine light, not as a yes or no verdict on needing treatment. Deciding whether treatment is necessary depends on a combination of factors: biopsy results, scans, and a thorough evaluation of the specific type of prostate cancer involved. So why has PSA testing sparked such debate? The controversy isn't just academic. It affects real people, real families, and real outcomes. For years, urologists have remained steady advocates of PSA testing, but primary care physicians, who perform the majority of these screenings, have grown more cautious. Their concern is that too many patients were being pushed into overtreatment, undergoing unnecessary procedures and enduring side effects for cancers that might never have caused harm. To protect their patients, some primary care doctors stopped offering routine PSA testing altogether. It's a classic case of throwing the baby out with the bathwater. While this approach spares some men from overtreatment, it also means that some aggressive cancers may go undetected until they're no longer curable. A pivotal moment came in 2012, when a government-appointed task force issued strongly negative recommendations about PSA testing. This move had a tremendous impact on how PSA screening was perceived and practiced. However, in 2016, the task force reviewed the evidence again and reversed its position, acknowledging that PSA is a valuable tool, if used and interpreted properly. Since then, PSA testing has been restored as an important option for men, provided that it's part of a thoughtful, individualized approach. Now let's address a fundamental question. If you're going to have a PSA test and your doctor gives you the results, what should your PSA level be if you don't have prostate cancer? Most labs set the normal threshold at 4.0 nanograms per milliliter, (ng/ml) or less, though some use a lower cutoff of 2.5 nanwash/ml or less. These thresholds vary from lab to lab, but they offer a reasonable action point for further evaluation. The PSA test isn't perfect, far from it, but when you're screening millions of people, you need a practical threshold for deciding who should have additional testing. What if your PSA comes back and it's under 1? That's excellent news. Very low PSAs, below 1, are associated with a very low risk of developing clinically significant prostate cancer. Some people might wonder why. If the normal cutoff is less than 4 or 2.5, we highlight 1 as especially reassuring. The reason is that significant prostate cancers can still occur at PSAs of 2 or 3, so it's misleading to claim that any result under 4 is always safe. But realistically, you can't investigate every single slight elevation. That's why other factors come into play. Let's explore some of those additional factors, starting with the relationship between PSA levels and prostate size, a concept called PSA density. PSA density is essentially the ratio of your PSA number to the size of your prostate, as measured by imaging, such as ultrasound or MRI. The rule of thumb is about 10.1. For example, if your prostate measures 30 to 40 cubic centimeters, a typical size for many men, then a PSA of 3 or 4 is considered normal. As men age, the prostate often grows larger, sometimes reaching 60, 80, or even 100 cubic centimeters. In these cases, a PSA of 6, 8, or even 10 can still fall within the normal range without indicating cancer. The key is context. A PSA of 10 in a man with a small prostate is much more concerning than the same value in a man with a very large prostate. But what if your PSA is in an ambiguous range, say 6 or 7, and you learn that you have a larger prostate? This scenario is common and understandably causes anxiety. While a larger prostate can explain a higher PSA, it doesn't rule out cancer. So, what should you do next? First, every man in this situation should have a digital rectal exam, a simple but important check that can give your doctor more information. From there, the next steps often include specialized blood or urine tests, such as the OPACO 4K blood test or the Select MDX urine test. These tests don't offer a simple yes or no answer, but instead provide a percentage estimate of your risk for significant prostate cancer. Here's how these tests can help. Suppose your OPKO 4K or Select MDX test comes back showing only a 4% risk of significant cancer. That's reassuring, and in such cases it often makes sense to simply monitor things. Repeat your PSA and possibly the specialty test in 6 months, and if the numbers remain stable, you may not need to do anything further. On the other hand, if the risk estimate is much higher, say 80% or 90%, that's a clear signal to take further action. You and your doctor should definitely explore more definitive evaluations. However, what if your risk percentage falls somewhere in the middle, say 31%? That's where things get more complicated. In these ambiguous cases, further imaging is usually recommended. The gold standard is the multi-parametric MRI, especially the 3 Tesla multi-parametric MRI, which provides a highly detailed look at the prostate. Other non-invasive options include color Doppler ultrasound. Some medical centers still rely heavily on random needle biopsies, which have been the standard approach for about 30 years. While biopsies can provide valuable information, they carry risks, including the possibility of serious infection. Many experts now prefer imaging first, as it's often more accurate and avoids the risks associated with invasive procedures. If imaging identifies a suspicious spot, doctors can then perform a targeted biopsy. Instead of taking random samples from throughout the prostate, they focus specifically on the area of concern. This approach not only increases the accuracy of the diagnosis, but also significantly reduces the risk of infection and other complications. Let's recap what we've learned so far. PSA testing is an important tool for men over 40 or 50, serving as an early warning signal for possible prostate problems. While the test is not perfect, when used thoughtfully, in combination with other factors like prostate size, PSA changes over time, and specialized risk assessments, it can help doctors and patients make more informed decisions. The key is not to panic over a single PSA result, but to use it as the first step in a careful, individualized process. If your PSA is below 1, that's highly reassuring, and your risk of significant prostate cancer is very low. For PSAs between 1 and 4, or 2.5 depending on the lab, the context matters. prostate size, rate of change, and additional risk markers all help paint a clearer picture. If your PSA is elevated, but your prostate is large, further testing like OPKO 4K or Select MDX can help clarify your risk. If uncertainty remains, advanced imaging is the next logical step, and only if something suspicious is found does a targeted biopsy make sense. We know this is a lot to take in, and navigating PSA testing can feel overwhelming. But knowledge is power. Understanding how your results are interpreted, what factors influence those results, and what steps to take next can help you work with your healthcare provider to make the best decisions for your health. If you'd like to revisit any of the topics we covered today, be sure to check out the timestamps in the description below. You can click directly to the section you're most interested in and review it at your own pace. We hope you found this breakdown helpful as you navigate your own health journey or support a loved one. If you have specific questions you'd like us to ask our prostate cancer experts, don't hesitate to reach out to us at info@pcri.org. Our website is packed with additional resources, so we encourage you to visit and explore the wealth of information available. If you found value in this discussion, please give us a thumbs up and hit the subscribe button. By doing so, you'll help others discover this important information and join a community committed to proactive, informed healthcare. Thank you for joining us today. Take care of yourself, keep asking questions, and have a fantastic week.